Hi, Manuel. My name is Will. I'm going to be your nurse today. How are you feeling?
Well, hello there, not Emmanuel, but close enough. I've been better, cooped up here for days now. Say, have you seen the doc? He's been as elusive as a unicorn today. And these IV drips don't get me started on them. By the way, you're not from around here, are you? Only locals call this place a hospital. It's a mere 15-minute drive from my casa.
Okay, yeah, no worries. So I can check in with the doctor to see when they're planning on coming on rounds. And of course, I know the IV is pretty annoying, but we're doing our best to try to keep it as infrequent as possible, okay?
That'd be great if you could track down the doc for me. As for the IV, I appreciate the effort, but it's still a nuisance. Speaking of discomfort, this Foley catheter is not helping either. I can barely move in this bed. But hey, at least I'll be back to my kitchen in no time, whipping up meals for my kids once I'm rid of all these medical contraptions.
Yeah, so always think of the positive here. So I noticed that your heart rate's gotten a lot higher and your blood pressure is down. Are you feeling any signs and symptoms right now?
Wow, you're right, my heart's racing like a horse. I thought it was just the anticipation of getting out of here. As for my blood pressure, I've been keeping an eye on it, cutting down on salty foods and all. Strange that it's low now. I haven't felt any dizziness or weakness, though.
Okay. Are you feeling like any hotness or anything like that?
Now that you mention it, I do feel like I'm running a fever. It's as if I'm sitting next to a fireplace or something.
Okay.
Is that concerning?
Well, let's go ahead and check your temperature here real quick, okay? And we'll see what it's going to say here. Okay.
All right, let's see what.
Your temperature is
I sure hope it's.
101.1.
Oh my, that's quite a fever you've clocked there. No wonder I'm feeling like I'm in a sauna. This doesn't bode well for my speedy recovery, does it?
No, but I'm going to go ahead and give your doctor a call anyways, just to kind of let him know of the heart rate and the blood pressure and your fever, because this could be some signs of sepsis. Have you ever heard of what sepsis is?
Sepsis? Like a severe infection? That sounds serious. I've heard about it, but never thought I'd be dealing with it myself. Please do call the doctor and fill them in on all this. I just want to understand what's going on and how we can tackle it.
Hi there, Dr. Bell. This is Will. I'm the nurse taking care of Manuel Rodriguez today. I just wanted to let you know that he is showing some signs of sepsis. He has a heart rate of 120, a blood pressure of 85 over 55, a temperature of 101.1 right now.
Thank you for bringing this to my attention. The patient's symptoms, including tachycardia, hypotension, and fever, are indeed indicative of possible sepsis. I would recommend starting him on broad-spectrum antibiotics immediately. Also, please monitor his urine output and get a lactate level drawn to assess the severity of his condition. Keep me updated on any changes in his status.
Okay, would you like to do a blood culture as well?
Absolutely. A blood culture is a crucial step in diagnosing sepsis. It will help identify the specific bacteria causing the infection and guide our choice of antibiotics. Please proceed with that as well.
Okay, and then what kind of antibiotic do you want to prescribe?
Given the patient's symptoms, I suggest initiating treatment with intravenous piperacillin tazobactam. This antibiotic has a broad spectrum of activity against various bacteria that could be causing sepsis. However, we will adjust the prescription according to the results of the blood culture.
Okay, and do you want to do anything for his blood pressure right now? It's 85 over 55.
Yes, the low blood pressure is concerning. Let's start with fluid resuscitation to help improve his blood pressure. If it doesn't respond sufficiently, we may need to consider vasopressors to maintain adequate organ perfusion. But let's see how he responds to the fluids first.
Okay, can you give me how much fluid? You want to probably do normal saline? Do you want to do 500 mLs or do you want to do 1,000 mLs to start?
I recommend administering an initial bolus of normal saline, around 1,000 ml, to address the patient's hypotension. This can help increase their blood pressure. However, Please monitor the patient's response closely and adjust the fluid administration as necessary.
Sounds good. All right. Well, I'll let you know once we're done giving all the fluids and seeing if it improves the blood pressure, and we'll get started on the antibiotics as soon as we're done collecting that blood culture. Okay. Anything else you want me to do?
At this point, it would be beneficial to ensure that the patient's comfort is also addressed. Please administer appropriate pain management medication if Manuel Rodriguez is experiencing any discomfort. Additionally, keep a close eye on his oxygen saturation levels and provide oxygen supplementation if needed to maintain adequate oxygenation. Lastly, don't forget to document all interventions and the patient's response in his medical record for further reference and continuity of care.
No problem. And he wanted to know when you're actually coming by today.
I plan to make my rounds later this afternoon, so I expect to visit Manuel Rodriguez around that time. If there are any urgent changes in his condition before then, please do not hesitate to contact me immediately.
All right. Sounds good. Thank you, doctor. All right, Mr. Manuel. So what we're going to do is we're going to go ahead and give you some antibiotics. Specifically, this antibiotic is called Zosyn.
Hold on. Before you proceed with Zosyn, I need to make sure it's not related to azithromycin. I had a bad reaction to that one before. But if Zosyn is safe for me, let's get this infection under control so I can bid farewell to this hospital room and say hello again to my beloved kitchen.
Yeah, so you shouldn't have any problems with an allergy of azithromycin. So we're also going to give you a bolus of normal saline. It's just IV fluids. And what that's going to do is it's going to help improve your blood pressure, okay? And all while we're doing that, we're going to be collecting your labs and getting blood cultures before we start your antibiotic. Do you have any questions?
Sounds like a solid plan. I'm glad you're on top of this. Just one thing though, why the need for blood cultures? Is it to confirm the infection before starting the antibiotics? And how long would these labs and cultures take? I'm curious as I've never had this done before.
Yeah, so this isn't it won't take too long. We're going to do our best to get it done in just one stick. It is going to be an IV stick here, unfortunately. But we need to get the blood cultures. You're exactly right, because of just to confirm what bacteria is actually in your blood. So that way, if we do need to get a more precise antibiotic, we'll start it then when we get the results.
I see, so it's like detective work for bacteria in my blood. Quite fascinating, though I must admit I'm not thrilled about another needle prick. But if it helps get me the right treatment faster, then let's do it. Just make sure you've got a steady hand.
Yes, I will do that. So first thing I'm going to do is I'm going to actually go ahead and give you your fluids first. We're going to take care of the blood pressure first. Your heart rate is getting higher as well. So we're going to take care of that blood pressure, and then we'll come in with the blood cultures, okay?
All right, you focus on the blood pressure and fluids first while I brace myself for that blood culture test. Time is of the essence here, especially with this fever and potential sepsis. Just let me know when it's time for the needle so I can mentally prepare.
No problem. And then I will be bringing in some Tylenol for you as well. That's already on your medication list, because that's going to help reduce your fever, okay?
Thank you for the Tylenol to combat this fever. It's a relief to know there's something to cool me down. Keep me updated on the doctor's response and the results of those blood cultures, as I'm eager to solve this medical mystery and get back on my feet.